Did you know there's a stroke and heart attack risk even more dangerous than bad cholesterol, and most people over 60 don't even know it exists? It silently damages blood vessels, causing clogged arteries, ruptured vessels, and brain hemorrhages, even when your LDL cholesterol appears normal. Why do so many people suffer a stroke despite having low LDL? And how can you prevent stroke in older adults if the real threat is hiding right inside your blood report, overlooked by nearly everyone? Let's uncover this forgotten truth. It may just save your life or the life of someone you love.
Before we dive deeper into this hidden risk, let me share a true story about a man named George, 68 years old, living in Florida. George is a retired truck driver. He doesn't smoke, eats fairly well, and during his last checkup, his LDL, bad cholesterol, was 95, well within the safe range, according to standard medical guidelines. He felt reassured. But just 3 weeks later, while walking his dog around the neighborhood, George suddenly felt dizzy, his vision blurred, and he collapsed on the sidewalk. At the ER, doctors diagnosed him with a transient ischemic attack, a mini-stroke. Further blood tests revealed his triglycerides were abnormally high, his HDL was low, and most alarmingly, he had elevated levels of small, dense LDL particles. He was confused. "How could I have a stroke if my LDL is normal?" George asked. The answer: he was carrying a biological time bomb that no one had warned him about. And George isn't alone. Millions of seniors feel safe because their cholesterol numbers look normal, while the real culprit is quietly circulating in their bloodstream. For many years, whenever you visited your doctor for a checkup, the conversation has likely centered on one particular number: your bad cholesterol. The message has been clear and consistent. Keep that number low to shield your heart and brain from the dangers of heart attacks and strokes. While that advice isn't wrong, it only tells part of the story. There's a silent killer that poses an even greater threat than bad cholesterol alone. It stands as the leading risk factor for strokes among Americans, particularly for those of us who have celebrated our 60th birthday. The trouble is, it often goes unnoticed until it's too late. So what is this hidden danger? And why might a narrow focus on your total bad cholesterol lead you to overlook other crucial warning signs? Let's explore this together.
We've learned to think of cholesterol as having two sides: HDL, the hero, and LDL, the villain. For decades, the primary strategy has been to control this villain. If your LDL level is high, the standard recommendations are to cut back on saturated fats and possibly start taking a statin medication. This approach didn't come out of nowhere. It's rooted in one of the most significant and influential medical studies of the 20th century, the Framingham Heart Study. This landmark multi-generational research project in Massachusetts was the first to establish a clear connection between high LDL cholesterol levels and an increased risk of heart-related problems. This was a revolutionary finding that has shaped the medical advice we receive to this day. However, that's just the beginning of the narrative. As researchers delved deeper into the extensive data from the Framingham study, a more nuanced understanding began to take shape. They found that the total LDL number is a truly strong predictor of risk only at the extreme ends of the spectrum. 1. When LDL is exceptionally high, often above 190 milligrams per deciliter, the danger is undeniable. However, this level of elevation is frequently due to a genetic condition known as familial hypercholesterolemia. 2. When LDL is very low, below 70 milligrams per deciliter, the risk of heart disease and stroke is minimal. But what about the majority of us who find our LDL levels somewhere in the middle, in the normal or borderline high range? This is where the conventional wisdom becomes less clear. For a large portion of the population, especially those over 60 without genetic risk factors, the total LDL number can be a surprisingly unreliable indicator of true risk. It's true that studies have shown a correlation. Higher LDL levels are associated with approximately a 30% greater risk, but an association is not the same as a cause. Think of it this way: just because you see more umbrellas on a rainy day doesn't mean the umbrellas caused the rain. When analysts controlled for genetic factors and focused solely on the over 60 age group, the connection between the total LDL number and heart attacks or strokes became surprisingly weak. This raises a critical question. If the total LDL figure isn't the main character in the story of our heart and brain health, what is the real actor we should be watching? The answer lies in a detail that 99% of people, and even many doctors, overlook when looking at a standard cholesterol test.
Imagine this common scenario. Your lab results show an LDL level of 100. What happens next? Almost certainly, you'll have a discussion about getting that bad number down, usually through a low-fat diet and a familiar medication, a statin. But here's a startling paradox we need to confront. Statins are one of the most prescribed medications in the world, and we've become much better at treating strokes and heart attacks with faster ambulances and more effective stent procedures. So while the number of deaths from heart attacks has decreased, the total number of heart attacks is on the rise. We're getting better at putting out the fires, but we don't seem to be preventing them from starting in the first place. This leads to a crucial scientific question. A major clinical trial, known as the Accelerate trial, found that a drug highly effective at lowering LDL cholesterol did not actually reduce the risk of heart attacks or strokes. How could this be? How could lowering the very number we've labeled the villain fail to improve the ultimate outcome? And this is where we uncover the truth that most people miss, a secret hidden in plain sight within your own blood work. The standard lipid panel you receive has a significant limitation. It treats all LDL cholesterol particles as if they're identical, counting them as a single number. But the reality is, there are two distinctly different types of LDL. Think of your LDL as vehicles on a highway. The first type, making up about 80% of the total, is like large, fluffy cotton balls, large, buoyant LDL. They're big, move smoothly, and have a hard time squeezing into the small cracks in your artery walls. This is the type of cholesterol that increases when you eat more fat. And most importantly, this is the type of LDL that statin drugs are most effective at removing. In essence, they're not the primary threat. They're more like big, harmless teddy bears. Now, let's meet the real culprit. Its name is small, dense LDL, or pattern B LDL.
Imagine these as small, fast, and agile race cars. They only make up about 20% of your total LDL, but they are the primary cause of the accidents. Their small size allows them to easily penetrate the delicate lining of your artery walls, initiating the inflammatory process that creates dangerous atherosclerotic plaques, the very plaques that can rupture and lead to a stroke or heart attack. And here is the crucial point. This dangerous type of LDL doesn't increase significantly because of dietary fat. It skyrockets when we develop metabolic syndrome, a condition often driven by consuming too many processed foods, especially refined carbohydrates and sugar. This perfectly explains the statin paradox. The problem is that statins are like a highway patrol team that is excellent at catching the big, bulky trucks, large LDL, but often lets the smaller, more dangerous race cars, small, dense LDL, slip by. This isn't just a theory. The Jupiter trial confirmed a startling fact. Even in patients taking statins whose total LDL-C levels were brought down to very low levels, around 54, their risk of heart disease and death still increased significantly if they had a high number of these small LDL particles. This raises an obvious question. If the evidence is so clear, why does the medical system remain so focused on lowering total LDL for everyone, including those over 50?
There are three main reasons. 1. Financial incentives. The role of the multi-billion-dollar pharmaceutical industry cannot be ignored. 2. The understanding that small LDL is the primary culprit is a relatively new discovery, and it takes time for this knowledge to become widespread practice. 3. Data from early statin studies appeared much more promising than their actual benefit for the majority of the population. Let's talk about that actual benefit. In trials, for the most ideal statin candidates, how long did taking the drug for 5 years postpone their death? The answer may shock you, an average of 4 days. So what about the newer drugs? Medications like Repatha, Evolocumab, a PCSK9 inhibitor, are indeed very powerful. They lower LDL, and yes, they have been shown to reduce the number of heart attacks and strokes. This is good news. But once again, we encounter another paradox. To date, they have not shown a benefit in terms of overall longevity, all-cause mortality. This points to a critical truth. Simply targeting the total LDL number is like mopping the floor while the faucet is still running. We are treating a symptom, but perhaps we are missing the true root cause of the problem. Before we continue, if you're finding this video helpful, please consider subscribing to the channel.
The root cause is a condition called insulin resistance, which is often the first step toward metabolic syndrome. Think of insulin as the key that unlocks your cells to let in energy from blood sugar. When you're insulin resistant, the locks on your cells become worn out and less responsive. In response, your body has to produce more and more insulin to get the job done. This insulin flood is the very signal that tells your body to create more of those dangerous, small, dense LDL particles. And what causes insulin resistance? The main culprits are typically a diet high in processed foods, refined carbohydrates, and especially added sugars. This is precisely why when people cut fat from their diets, they often don't see health improvements. They replace the fat with sugar and other bad carbs, inadvertently turning the faucet on even stronger. If you need more proof, look no further than the Leon Diet Heart Study. This research showed that heart attack survivors who switched to a Mediterranean-style diet, a diet rich in whole foods and by no means low in fat, had far better results in preventing future strokes and heart attacks than seen in the statin studies. So how can you tell if your own faucet is running? How can you get a truly accurate compass for your heart and brain health?
The answer is right there in your standard cholesterol report, but it's not the total LDL number. Instead, look at two other markers. Number 1, triglycerides. This is the key player we need to watch. Triglycerides are a type of fat in your blood. Once they've done their job of delivering energy, the body converts them into, you guessed it, small, dense LDL particles. Therefore, your triglyceride level is the best indirect measure of how many dangerous small LDL particles you have. In one large American study, 2/3 of all people who had a heart attack also had metabolic syndrome, and your risk increases by 80% when you have high triglycerides, a number far higher than the risk associated with total LDL alone. Number 2, HDL, good cholesterol. This is our ally. HDL helps clean out cholesterol from the arteries. Now let's put these two numbers together. The ratio of your triglycerides divided by your HDL, TG-HDL ratio, is your most powerful compass. It tells you the true balance between the bad guys and the good guys in your system. It is the best indirect way to assess your level of insulin resistance. What's the general rule of thumb? Triglycerides. Ideally, they should be under 100 milligrams per deciliter. If they are over 150, it's almost certain you are dealing with metabolic syndrome. HDL. For men, aim for over 40. For women, aim for over 50. The higher, the better. TG/HDL ratio. For Caucasians, if this ratio is over 2.5, it's a warning sign. For African Americans, that number is 1.5. So now you have the tools. The next time you get your lab results, look beyond the total LDL number. Find your triglycerides and HDL. Calculate the ratio. That is the true picture of your health.
This is why major health organizations recommend that adults consume no more than 25 grams, or about 6 teaspoons, of added sugar per day. And not surprisingly, the very things that help turn off the insulin resistance faucet are the same things that lower triglycerides and those dangerous small LDL particles. Studies have clearly shown exercise, regular physical activity, whether it's a brisk walk or a run, has a wonderful effect. Fish oil, omega-3s. Supplementing with omega-3s or eating fatty fish like salmon has been proven to reduce both triglycerides and inflammation. And this brings us to the three main pillars that contribute to the formation of plaque in our arteries: small, dense LDL particles, chronic inflammation, and trans fats. If you genuinely want to minimize your risk of stroke and heart attack, your plan is simple, yet incredibly effective. It revolves around what you eat, how you move, and of course, not smoking. So, what should your eating plan look like? 1. Cut back on sugar and refined carbs. This is the most critical step. 2. Eliminate trans fats. Read your food labels and stay away from anything that lists partially hydrogenated oil. Be careful when cooking with vegetable oils. Don't let them get so hot that they smoke, as high heat can turn good fats into bad trans fats. 3. Balance your omega-3 and omega-6 fatty acids. In the modern diet, which is heavy in processed foods, the ratio of inflammatory omega-6s to anti-inflammatory omega-3s is often around 20:1. Our goal is to bring this ratio closer to 1:1 by eating more fatty fish, walnuts, and flax seeds, while reducing processed vegetable oils. This balance is the key to controlling inflammation in your body. You're not too late. You're not too old. But you need to act, starting today. Don't wait for a stroke or heart attack to shake your world before reviewing your health markers. Don't let stable numbers on your lab report give you false comfort, because the real danger may already be growing inside your arteries. By simply changing how you eat, moving your body a little more each day, and learning to track triglycerides, HDL, and insulin resistance, you've already taken a huge step toward preventing clogged arteries, brain bleeds, and vascular rupture. If this video helped you see what truly matters behind the numbers, please share it with someone you care about, because one small action today could save a life tomorrow.